our patients dependent on us?
Not at all. So self-care is the most important thing because that makes them more independent. So over here, taking over from what Dr. Bharti and Dr. Padmini was telling, so a better qualified nurse will make them better decision makers. So we spoke about training, but what we missed today is a structured training program.
True.
So if we introduce a structured training program, and a while back, Dr. Pallavi was also mentioning about supervision. So this is what we need to include in today's program today. If we have a structured training program, they would be the best advocates as to what we need to teach them and how do we take care of a patient. So they will be able to take the patient along throughout the journey of continuum of care. And that is how we tell them about the entire episode, about from prevention, from screening, prevention, going home, taking care, because there's an entire episode to it. Because it doesn't end over after giving treatment. Cervical cancer, we don't wind up over there because we come back again with not many issues. So this is what we need to include, and we need to teach the nurses how we need to relate to the patient back again. And unless and until we equip them, the continuum of care cannot be continued.
Okay, so that self-care must be taught to our patients and perhaps the relatives also, because I think this is again the most untapped resource. If we accumulate the expertise in the relatives, they will be of great help. Fine. We move on to the third round, and that's collaboration with multidisciplinary team. So my first question is to you, Dr. Bharti. An oncology department's success often lies in the harmony of the multidisciplinary team. However, diverse specialists working together, a common goal, risk miscommunication, and thus optimal performance. Can digital technology help here?
Of course, I think we have to capitalize on this wonderful digital platform we have with us now. Reiterating the previous question, even for self-care, I think this digital platform does help us to monitor our patients, whether they're doing the self-care, and we can talk to them of many issues on the digital platform. And similarly, especially in this vast country of ours, where we have little access in most of the rural areas for the multidisciplinary approach. We may not have an oncologist on board, we may not have a cytopathologist on board. So in such cases, especially when we have the digital colposcopes nowadays, where even if the healthcare workers are doing the screening, they upload the images, and the expert gives us the opinion as to what is to be done for that particular patient. So that the multidisciplinary approach with the healthcare workers, screening at the grassroots level, and then the secondary primary care physician telling them, guiding them as to what is to be done, and then incorporating the cytopathologist and the oncosurgeon on board, who is in a distant city and who has his time, his or their time for that particular approach, and then we all sit together as a team, and definitely we can give the best care to them on this digital platform, and we all need to incorporate this in our clinical practice.
Perfect, perfect. My next question to you is to you, Sindhu. Volunteers is an integral part to the efforts of World Cancer Care to reduce the impact of cancer on our communities. Do you encourage a role for this new cadres, volunteers for sure?
To tell you all frankly, I don't think we can survive in Tata Memorial Hospital without volunteers.
Beautiful.
Believe me. Because we spoke about nurse navigators, I'm speaking about patient navigators and various NGOs who hold our hands and patients' hands every day. Because the continuity of care is because of them, because it's not curative alone, it is rehabilitation also. I mean, in one of the sessions, an expert spoke about the losing job, they coming back again, the family, the children, and these are the people who put them back into life. The balance which is maintained, it is a fund which is allocated to them. The hand-holding which many of the organizations which give them is what makes us work for them. The care what the medical fraternity, by which we are able to reach out to them, is because we know that there are people who are backing us and we know how to reach out to them. So I think they are an integral part, and we should know how to tap the potential to move further to help out our patients.
Just love your answer, Sindhu. Thank you so much. Okay, my next question is to Dr. Srinivas. Um, you say social workers are very important as a multidisciplinary team, and often we find them just doing the financial aspect. Do you find an expanded role that they can perform?
Definitely, madam. Definitely, so many NGOs have come forward nowadays. So Roach company has come forward, and Find company has come forward. So we had with Find we had 4 months back we had a roadmap to cervical cancer. We had a same seminar has been done in the Bangalore itself. Our health minister has inaugurated. So so many companies have come forward for the cervical cancer diagnosis and progress and treatment. So it is very helpful for the coming years. So the government of Karnataka started chemotherapy centers all over the Karnataka, all the district hospitals.